I'm Tom Connally. I'm an endocrine surgeon for Norman Regional. And my great-grandfather was a doctor in Oklahoma before it was a state. And so I never knew him. He had passed away before I was born. But I grew up hearing stories about him and the caring, compassion, care that he gave to his patients. And so that was a big influence on me in wanting to do medicine. That's what I really like about Norman. I mean, I see my patients, but then and take care of them on a professional standpoint. But then I have developed personal relationships with them too. And as a surgeon, that's hard to do because we don't see our patients quite as often as a primary care provider would, et cetera. But you're at Walmart or you're at dinner somewhere and you see your patients, and it's fun to have that interaction. I really enjoy that. That's why I do it, and that's kind of what my grandfather. The stories I hear about him, it was that he had a mark on their lives. So they're really neat. So if a patient chooses to see me in the office, I think it's important that patients are confident in the care I'm going to provide them. I try to take time to explain in detail what I expect. I try to go over the current guidelines and what the guideline recommendations are, and I try to give them options because today, particularly in the world of thyroid surgery, there are a lot of options in how to treat thyroid cancers. You can go from something as simple as observation only to an aggressive operation where the whole thyroid comes out. And so there's a lot of decision making that has to be made. I certainly don't want patients having to make that decision on their own, and I'm certainly not going to force a patient into making a decision because it's most comfortable for me. So I think being able to engage with my patients and try to make them, to the best of my ability, help them understand what their disease process is, what their long-term expectations should be, explaining in detail what complications are and what can happen, and try to best predict that for them is what I try to do. And I try to make it so it's comfortable for them to ask me questions, and I encourage them to get second opinions because I want them confident and comfortable and understanding in what they're going to have to go through. Now, unfortunately, I know surgery. I do this every day, and so sometimes I may not be able to make that connection, but I want them and encourage them to ask us questions, ask my team questions, come back for second opinions if they need, or second visits with me if they need to, because I really want them to understand what they're going through. Surgery's scary. It's not fun. But it's a necessary thing that we have to do for our patients. And so I want them to be confident and comfortable as best I can make them throughout the process.